Good afternoon. I'm Ann Harrison, Dean of the Haas School of Business at UC Berkeley. Welcome to the first of our new twice-a-month series hosted by UC Berkeley faculty. I'm really thrilled to be kicking off this lecture series where we will be sharing new thinking and research on a range of topics around business, economics, and equity and inclusion during this coronavirus pandemic. These talks will feature faculty from Haas, from UC Berkeley, and other leading experts from other institutions. One of our hallmarks at Haas is to combine academic rigor and conscience. So I call it rigor and conscience, or R and C, not R and B, not R and D, but R and C. And I really hope that you'll see rigor and conscience at work today and in our future talks. I also want these conversations to be a source of information and new thinking as we persevere through these extraordinarily challenging times. We're live streaming this series live on YouTube, where you can ask questions, chat both today and in our future events. So today I'm joined by Kellie McElhaney, who's a distinguished teaching fellow and founding director of the Haas Center for Equity, Gender, and Leadership. Kellie has been at the forefront of the concept of equity fluent leadership, leaders who understand the value of different lived experiences and use their power to address barriers, increase access, and drive change. Among a number of activities she has led in this space, she's written case studies about companies that are investing in women and equity fluent leadership. Her research focuses in the area of equal pay, conscious inclusion, equity fluent leadership, and how diversity and inclusion creates value for companies. In 2003, she founded the Center for Responsible Business, which has solidified our corporate responsibility as a core competency and competitive advantage at the Haas School. Thanks so much for joining us, Kellie.
Thanks, Ann. It's nice to be here.
So let's start with health. We're increasingly hearing that COVID-19 has been hitting Black and Brown communities and women the hardest. Would you like to say some words about that?
Yeah, I'll start on, thanks for the question. I'll start with women first. The plain and simple reason it's hitting women harder is that women disproportionately hold a higher number of healthcare jobs. Upwards of 75% of healthcare jobs are held by women. If you look at healthcare support jobs, around 85% of those jobs are held by women. And if you think about who checks you out at the grocery store, who are at the drugstore, it's disproportionately staffed by women. So it's pretty simple in terms of women, and why it's hitting women. It's because of where they are working and their higher level of exposure. It's more difficult when you get to talking about Black and Brown or Hispanic and African American populations, because not only do they also occupy, so imagine being a Black woman, not only are they also occupying a higher percentage of these frontline worker positions and retail and food delivery. They also have pre-existing health conditions that they have not had the access to adequate health care. So there's so much else going on. They don't have necessarily the ability to socially distance, given the multi-generational living or the different set of living conditions in which they're living, to protect themselves or to quarantine. So it gets much more complicated when you layer on race and ethnicity over gender.
I see. I've just been deeply dismayed by the numbers that we're seeing in the data. I just read a paper by Carrie Gross and some co-authors at the Yale School of Medicine, and they found that the mortality rates, if you're African American, are triple the rates white, and the rates for Hispanic and Latinos are double the rates for non-Hispanic whites.
Yeah.
Navajo Nation has one of the highest mortality rates in the nation. So this is just really, really disturbing. Let me just give you another example I read about. There's been a recent study done of a hospital in Louisiana, and the vast majority of the patients in that hospital and the deaths are African American, even though around that hospital, 2/3 of the local population was white. So maybe you could tell me a little bit more about the racial disparity in these mortality rates. And I just want to quote Graham Wood, writing in The Atlantic. He wrote, "Outrage is warranted, but the outrage unaccompanied by analysis is a danger in itself." So could you tell us a little bit about what the analysis tells us about the reasons for these massively different health effects of COVID-19 by race?
Yeah, so I've been thinking a lot about how sick systems equal sick people, and I think that we have sick systems. I mean, you can look at the medical research and the level of pain that an African American patient has to indicate that they have before they get treated versus a white patient. Significant gap there. I'm surprised anybody would push back on analysis and the data, because the data is so overwhelming. Even before COVID, the disproportionate impact of being Black in the healthcare system, even the fact that physicians don't, when they enter a room, don't stand as physically close to a Black patient as they do to a white patient. And we know that healing is improved when you have a closer distance. When a doctor comes into your hospital bed and sits by you and puts his hand or her hand on your hand, and the medical field is rife with bias in healthcare treatment. Who gets access? I read this spring that African Americans are two times more likely to end up in the hospital if they do test positive for COVID, and yet African Americans are getting tested at significantly lower rates because they have lack of access to testing.
Discrimination in healthcare, access to healthcare. I've also lack of sick leave, much like
Absolutely
lower ability to have sick leave. I've also heard that there are differential costs to engaging in social distancing if you can't work from home, if you don't have outside spaces. We know that being outside or spending more time outside, you're less likely to get it. This is pretty worrisome. The healthcare numbers are really devastating to me. So in our white population in the United States, maybe only 6% don't have access to, health insurance, access to health insurance. But in our Hispanic population, our Latinx population, 20% doesn't have access to health insurance. So it's enormous. Maybe we can move now to differential economic impacts of COVID-19. What do we know about the differential economic impacts on employment, on incomes by race and by gender?
Yeah, well, I'm talking to an economist, so I kind of want to just put that right back on you, but just some large sweeping trends. I mean, you talked about paid time off. That's one of the biggest issues that kind of blends, obviously, healthcare and economics, because if I can't afford to take time off, if I'm an hourly worker or part-time worker, and worst case scenario is I'm experiencing symptoms of COVID, I'm going to continue to go to work as long as I can if I need to put food on the table. The other piece of that is if God forbid, my child has COVID or my spouse has COVID, I can't take, I'm not only being exposed at home, possibly, I'm coming to work and further exposing. So just the economic impact of, the job loss. Black and brown individuals are much more likely not only to have experienced job loss, but to have had somebody in their household experience job loss. So there's a loss to the household income, not just their own. And if they haven't experienced job loss, they're more than likely to be in hourly positions or shift positions, and so had their hours reduced, their shifts, reduced. So it's quite bad. And then you look at the business ownership side. I mean, Black and brown owned businesses have been significantly more likely to have been shut out of the Paycheck Protection Plan. I mean, this is very sad to me. Why? Because in the first tranche of the Paycheck Protection Plan release of funding, they allowed authorized banks to distribute this funding. Well, if you don't have a pre-existing relationship with an authorized bank, it's a first come, first serve model. You're not going to be the front of the line because you're not even their customer at that bank. So you see a disproportionately large amount of Black, brown, and women-owned businesses who have historically had a hard time getting capital going out of business because of COVID.
Okay, so that's consistent with the evidence that I've read in the NBR Working Paper series. For example, we have a UC Santa Cruz professor, Robert Fairley, using CPS data, looked at the number of small business owners, and on average, there was a 22% drop in small business owners between February and April. But if you look at it by race, the drop in African American owned businesses was really hard. They had a 41% drop of small businesses. Latinx business owners had a 32% drop. And actually, Asian American business owners also dropped by 26%. So these are very large drops. It's looking through the evidence, it looks like there are huge differences in economic effects of this crisis, which has, we know, led to at least a 15%, likely a 20% unemployment rate in the United States. The differences are enormous across race, across education. Immigrants are much more hit, lower income families are more hit, women are much more hit, and small businesses owned by women and owned by minorities are much more hit. So it seems to me like people that were least able to weather the storm have been the hardest hit. So knowing that there's this enormous difference in impact, what has been the general reaction from the corporate world?
So that's the work we're doing on our equitable recovery playbook. You know, corporations, we tend to talk about them as if they're entities, they're individuals, they're humans. So there's been sort of this bimodal distribution of how they've reacted. There's been the emergency reaction of, we have to get, personal protective gear into the hands of our employees. We have to just sort of throw things that are really quick, reactive, and that aren't going to necessarily help with the systemic problems. And then there are companies, and I can't say a lot of them, a lot of talk from companies that they need to be looking at the more long-term systemic challenges that are being just absolutely laid to bear in this pandemic. But those are things like, primarily, I think the single biggest thing we are learning is that there's been a complete loss of touch with the worker experience, with really understanding what our workers are experiencing day to day in terms of paid time off, in terms of childcare, elder care. Just workers have been very much disconnected from the decisions that are being made inside of these companies about their experience.
Well, let me follow up from our last conversation. We just saw that there was very inequitable effects of COVID, both in terms of health outcomes and in terms of economic outcomes, with race being a factor and being female factor. Are companies systematically trying to help Black and brown workers more? Are they trying to help women more, knowing that it's harder for them? Do we see any differential response on the part of companies?
I think they're trying to, how do I say this? So let's take it from the big corporate headquarter type perspective first. So layoff lists. So the first thing you saw happening, at least from the corporate sort of headquarters side of things, were layoffs. And you would see these lines saying layoffs are colorblind. Well, first of all, nothing's colorblind. And we know from previous rounds of layoffs in 2001 and in 2008 that layoff lists were significantly disproportionately laying off women and people of color. So a really simple solution that has been discussed, instead of having a layoff list that is just a series of names, why don't you have faces so that you can see? Because let's face it, often people of color and women occupy less prominent, less high positions inside of a company. So, I've heard CEOs say, we just had a whole wall with actual pictures. So we're not just talking about positions or names, we're seeing faces, we're seeing who we are laying off. How do we redeploy? So you have some companies who knew that they were going to lose a significant amount of their diversity through their layoffs. So they looked at, how can I redeploy somebody? Because if I'm doing something in this group, it doesn't mean I can't go over and do it in this group where you are heavily needed during this. So I think layoff lists in terms of a large scale corporate role, but you see the company in terms of what your question around Black and brown and women, the single biggest reaction from companies is to support hourly workers. And so you're seeing an increase of $2 an hour. I think Whole Foods was one of the first. Amazon/Whole Foods was one of the first to announce that they were increasing minimum wage by $2 an hour. So that's a short-term, immediate reaction. But guess what? They're only planning to do that during COVID. So what does that mean? We don't even know how long COVID's going to be with us, but why would you end it if you needed it in the first place? Perhaps it's something that you should continue to look at, is what is a fair wage for our workers? Why are they so, as you said earlier, just barely able to get by, such that when something like this happens, it just rips every bit of rug out from under them?
Okay, so what you're suggesting is that some good practices, some best practices would be personalized these horrible layoffs. That would be one thing. You're also suggesting that if you're raising wages, why only do it during COVID? What are some other best practices and companies that are engaging in best practices? What are some leaders here in the response to COVID that we should know about?
One is Levi, and I like to talk about Levi because they're across the bay, they're hometown hero, but they did extend paid time off to their hourly workers and their part-time workers forever. This is not just something, maybe, you could say, well, why didn't they see the need before COVID? So clearly the need was magnified during COVID, but they have extended that forever. Like, absolutely somebody who's hourly needs time off to care for themselves or a loved one. Target, and I often, I absolutely wonder if, because of Target's physical location of their headquarters being in Minneapolis, they've really worked hard to increase wages and maintain that on the paid time off. I think that the area that you're not seeing, Anne, and what we're seeing in our research, is one of the things that has to happen now is this concept of profit sharing, co-determination, something where you're not isolating your workers, who are, by the way, responsible for a significant amount of economic gain that your company is making, isolated from the decision making, from the boards. I mean, co-determination, I don't know a lot about it. I am sure that you know a lot about it. It's come up a lot in the literature around companies who do well in the long run, and countries where they have more of a co-determination model will weather things like this more successfully.
Well, that's really interesting, referring to another NBR working paper that just came out. The US's unemployment rate as a response to COVID and the way we've dealt with it has risen to, formally, it's around 18%. It could be higher. In Germany, where there is a lot of profit sharing and where workers are very involved and the government's response has been quite different, the unemployment rate is steady at 5%. So we're seeing very different country level outcomes and responses to the challenges. So what, maybe we could shift a little bit, since we don't have much time left before we open it up to Q&A. Why don't you tell us a little bit about the Center for Equity, Gender, and Leadership? I understand you recently released an equitable recovery playbook. Why did you decide to do this playbook, and what's it about?
Yeah, so I'm gonna read a quote of why we decided to do it. We just decided. We read this quote from Sandra Taylor. I don't exactly have it in front of me, but she talks about, she's an African American spoken word activist, poet, and she talked a lot about, everybody was saying, let's return to normal. What are we going to do to return to normal? How fast can we get back to normal? And she said, hold on. I don't have her words right in front of me, but so I don't want to claim them. But she said, we don't want to return to normal. Normal was not working for a significant amount of the population. Normal was greed, anger, exhaustion, frustration, violence. And so I read this quote, Anne, and I just thought, I don't want to be any part of any return to normal. So we already had in the Center for Equity, Gender, and Leadership these playbooks that we're putting out, which are evidence-based plays on looking at what's going on around dual career couples was our first one. What's the evidence that dual career couples suffer disproportionately in the workplace because of all the else that's going on, and that women in that dual career are disproportionately suffering? So, and then we put out strategies based on those evidence, on the evidence that we find.
So let's go to a specific example. Okay.
Yeah.
what we're seeing is that women are having a much tougher time in America as a result of COVID-19 than men, in part because they do a lot more of the work at home. They have different kinds of jobs. What would be in a couple? What would be your specific recommendations to a couple in dealing with an equitable recovery in your playbook?
We just had a webinar about this last week. I mean, for anybody, but particularly for couples, it is to draw boundaries around, because now there's no boundary, right? It's always disproportionately had a negative impact on caregivers, whether it's a man or a woman, whomever in a family, if you don't draw boundaries between your working hours and your care hours. And now, I just read an article yesterday that talked about workers are being 3 times more productive during COVID, during shelter in place. And that was touted as great. And I'm thinking, yeah, but that's not unequivocal who is 3 times more productive. So if you are a man or woman or in a dual career couple, it's the balance of those trade-offs. But it is, one of the dual career couples on our webinar last week said it is absolutely to shut it down at whatever time, not indicating any set time, but shut it down. Take your entire working space off your dining room table and spend time together. It is to still act as if you are physically leaving the workplace and that you are now at home. It is for companies have done all kinds of things, no meeting Fridays, or, won't schedule meetings after 4 p.m. because you can be available 24/7 now that we're working from home.
So we're going, I think this is my last question before we open it up to questions from the audience. And I see we already have one question in the chat. So on a local level, I understand you've been working with Oakland Mayor Schaaf's Economic Advisory Committee. What are you working on as part of that committee?
I've lived in Oakland for 18 years. I'm just really committed to the diversity of Oakland for just for Oakland to make it. So in Oakland, we know is heavily black and brown, or more heavily than, of course, San Francisco or Berkeley. So what Libby is looking at is how do we look at these racial disparity outcomes that we're seeing and rebuild? Like, let's just take this as an opportunity to address the racial disparities that we had before COVID that are just being absolutely magnified and blown up during COVID. And how do we rebuild? So what are those gaps? What are we doing around the Black and brown owned businesses that have gone out of business disproportionately as it relates to white owned business? What are we doing around rent relief? What are we doing around pushing around buying local or collaboratives? How do you get, so if this business in Oakland has to lay off a large tranche of workers, how can we have a communication collaborative so that these other businesses who need to hire more workers because of what's happening, those can be the same workers? So it's really around, the Safe Streets initiative. You talked earlier about people in Black and brown communities don't have as much ability to socially distance or be outside. So that was one of Libby's solutions with Safe Streets, where she shut down over, I think, 25 miles of streets in the city of Oakland so people can get outside and socially distance. It's really one of the single biggest things I hear on those calls. And the council is incredibly diverse. I mean, it is just, I'd say the most thing I am in awe of is how diverse this committee is. So I'm listening to a nail salon owner. I am listening, I'll just tell you this one quick story. I don't want to open up to Q&A, but we had a council Zoom the week of George Floyd's murder. And I'm a visual learner. So I just was looking at the Black and brown faces on the Zoom call and the sheer level of just exhaustion, overwhelmment, stress, horror. But there's this one particular gentleman, and I won't name him, but he just looked so exhausted. I actually had to fight back tears just because of the look on his face. So Libby came on. It was the day she had announced the curfew, and that was controversial here because curfews, can be seen as having historically been a racist measure that was implemented. So she ultimately, the protests and the damage that was happening, she implemented the curfew, and then she came onto our call. She had the news release, and she was, I think it was 8 or 9 p.m. I can't remember then. And this individual raised his hand and he said, "How would you advise me?" Because you weren't supposed to be outside after the hour, 9 p.m., I guess. He said, "How would you advise me? Because for the past 3 nights, I have physically been standing out in front of my shop front as a bodyguard, to keep my business from being damaged. How are you going to advise me about a curfew? And he had physically been out, by the way, for the past 4 nights until 5 a.m., physically being the bodyguard of his own store to protect it, going home, showering, spending a little time with his family, and then going back to his day job. And it's just, it's really opened my eyes to, it goes back to that worker experience. I would have had no idea that this was a Black business owner's experience in downtown Oakland. So just by having these people who are in high positions of government, all the way out to frontline workers in this one council has been profound. And I think it's a model that companies need to think about. Why is a board of directors all of these very elite, high level, high thinking, high paid people, and they don't have.
Okay, speaking of high paid and elite, we're starting to get a lot of questions from the audience. So I'm sorry, I didn't mean to cut you off.
No, it's good.
But I want to start to ask some audience questions from the audience. So the first question related to that is, how do executive pay cuts fit into this conversation? Is this that could be transformative right now, and is it being done?
We have this evidence in our playbook. So exec comp cuts were one of the first things that you just polled the average person. What do you want to see? How do you want to see corporate America respond? Exec pay cuts or comp was the first thing that people said. In fact, I was teaching an MBA class just as COVID was just absolutely taking off. And I said, okay, I was giving a talk to some executives the next day. I said to my MBA students, I have a group of executives I'm talking to tomorrow. 2 things. What should I tell them? Without missing a beat, our MBA students, exec comp cuts. And the second was lead with empathy. So about 27% of companies are saying they are cutting executive comp. They aren't saying the amount, what we're finding in our research, and they aren't saying what, so then what? What's happening with that money that's being cut? And we're seeing that there's a significant amount of, they're not cuts, they're deferrals. They're deferrals and payouts. So it's not happening nearly to the extent that we need to see it. I mean, I read in the New York Times, there are companies who have upwards of a 300x differential between what the lowest level employee and the senior level employee is making. And that's just unconscionable any day, but particularly during COVID.
As you know, I decided to take 25% of my salary and give it back to our students here at Haas for the next year. We have another question here. What do you think the future of work will be like post-pandemic? And how will this affect diversity and inclusion at work?
We're already starting to hear. I mean, we at Haas aren't meant to come back in mass until January. We're starting to see from tech firms, Facebook, Salesforce, that they're implementing work from home always if the employee chooses it. But it comes right back to what we talked about earlier with dual career couples or folks. I don't always want to make this a gender. Obviously, disproportionately women tend to take on more of the care, elderly, children, whomever. But men do too. So I try to not be really just put a hard line there. But if we are moving to a virtual world or working from home, it is going to disproportionately impact those who have the primary home and care responsibilities, which are women, lead to higher level of burnout. And something that's been on my mind lately around people of color is we know that racism exists. We know that people of color experience significant negative health implications because of the stress of systemic racism. So now you've got all that coupled in with trying to be more productive at home. It's going to have a negative impact, in my opinion, on people of color and women if it is not managed carefully.
So now we have a very big question.
I'll let you take it.
We're being asked, what is one thing that we can do as Huskies to make a difference in addressing systematic social and racial inequality in America in 2020?
Can I throw that back to you? And I'll give you my thoughts. I mean, I think that this is the big question, right? I think the very first thing we can do is admit that we're racist, that we all are products of a racist society. So educate ourselves. We've got to educate ourselves. I've been in this space for over 20 years, and I think because of what's been happening in the country in the past forever, but highlighted in the past 3 weeks, I've never realized how little I knew until these past 3 weeks. So it might sound strange and not a great thing to admit to your dean, but I have spent more time educating myself in the past 3 weeks vastly and in multiple different ways, from podcasts to Spotify playlists about the African American music history to movies to books. But I think the best
Can
thing
you
you can
recommend one thing, either a movie, a book,
yeah.
that everyone should either listen to or watch or read?
I mean, I hate to add to the pandemic of these books are absolutely out of print right now, but I do happen, and I use it in my classroom. White Fragility was the book that I have read that rocked me to my core. I just remember sitting on an airplane and having tears strolling down my eyes. And more so that one of the things that just struck me was it said, so how many, at the time my kids were, I'd say 17 and 19, and it said, one of the questions in the book early on was, how many teachers of color have your kids had in their educational upbringing? And I thought, I live in Oakland. I just thought, and I literally went through they had their first Black teacher as a sophomore at Bishop O'Dowd for world history. What I had in my mind thought they had Black and brown teachers. They were sports coaches. So just, I think, just
educating yourself.
Yeah,
Let me talk a little bit about what we're doing at Haas. One of the things that we're doing is it's really important what we look like, that we look like the rest of California. That's my first goal. And my second goal is how we behave. So what we look like, we are making sure that we represent a diversity of races and viewpoints and backgrounds in our student body, where we have a much more diversified board than we had before since I've started. We're diversifying our staff, and we're working on our faculty. More than 50% of the faculty we just hired for this incoming year will be women, which was certainly not true before. We hired a chief diversity, equity, and inclusion officer. We doubled scholarships, and we changed how we admit students, adopting a more holistic approach that focuses on what you have done to promote diversity and inclusion. Apart from changing what we look like, we're also working on changing how we behave as a school. Do we behave in a way that is inclusive? And this goes down to everything from classrooms to cases we offer. In fall of 2021, we have revised our core courses, which hadn't been revised in 20 years. And one of our core courses, which will be required by all incoming MBAs, will be a course called Leading Diverse Teams. And it's possible that we are the first major business school to require such a course. So I feel very proud about this core reform that we'll be implementing, led by Dana Carney and Ross Levine. I have a question here from Rosalind Payne. Recently, Larry Summers commented, "Care and count." What are companies doing to assure that their supply chains are also diverse? Kelly, would you like to take that question?
I want to say hi to Roz. I haven't seen Roz in a long time. She's been a mentor of mine. Supply chain is a focus. Vendors, it may sound small, but I will admit that I shop a fair number. I used to shop a lot. There's a retail store pledge called the 15% pledge, where they are allocating 15% of their shelf space to Black-owned businesses. So that's I love that. I think that's a fantastic start, and that's more of a systemic change. That's not, we're just going to do it because it's Black History Month for 1 month. But for supply chains, I think the biggest thing we're finding, Roz, in our work is that all of these things like living wage and paid time off for hourly workers, that needs to be extended down through the supply chain of companies. You do need to be looking at what the ownership of your suppliers looks like and really making strong commitments to ripple what you're doing for your workers all the way down into the supply chain. But it's still at the early stages. I think companies understandably are looking at their own employees first. So I would just say to you, Roz, it is to look at all that we are doing for our own employees first and make sure that extends all the way down into our supply chains, specifically and unequivocally and unapologetically people of color and women.
So thank you for that. So we have a question here from Carmen Palafox. Corporations are investing in URM-owned venture funds because of their multiplier effect. We agree that this is a good idea, and will there be more of these URM venture funds?
I'm happy to say that there is, and especially you can see it in the Bay Area. I mean, that's how you actually gain wealth. It's through that multiplier effect. It's not just raising the minimum wage, you know, a little bit here, a little bit there. That's not how you acquire wealth in the United States. We know that. So I'm a big fan of the venture fund models that you're seeing. I think I just saw Facebook started one. Oh no, it was Andreessen started a fund, and I was really happy to see that. Like, let's start to get some of this wealth into creating wealth in Black, Brown, and women-founded businesses, but primarily I'd say right now Black and Brown.
Thank you. So I have a question from Michelle. How can employees organize and mobilize without risking retaliation?
You're probably going to have to risk some retaliation. I would say you've never had less to risk than right now. You are, as an employee of a company, and I don't want to, let me rephrase that. For a white employer, somebody, let's take race and gender out of it. If you're in the dominant population in your employee, whatever that looks like, you have less risk. So I don't want to discount the risk to minority or non-dominant populations. I do think right now that all ears are up, but in terms of using your voice in a way that is low risk, I always say don't be the lone voice. Go recruit co-conspirators, particularly those, and I'll just be really direct, who exist as members of the dominant population. And I just never know in any kind of firm who's dominant, who's non-dominant. But right or wrong, non-dominant voices have higher retaliation and risk more. So we need to get the dominant voices together in mass, because it's much harder to retaliate against or to justify retaliating against a very large group of voices. So it's to gather co-conspirators for sure. But I do want to honor that people of color and women disproportionately suffer from retaliation and have higher risk to think about.
Thanks, Kelly. We have a question here from Jess, who's a Cal undergrad alumni. Nice to hear from you, Jess. How can we get involved into making a difference helping minority communities? Any places we can look for volunteering for these efforts?
You know, there's a number of lists that you can access in any, I know for the Bay Area, it's called Black Bay Area, that, you know, very least of which is to show me if I'm ordering food out tonight for my family, here are a list of Black owned restaurants in the Bay Area. There's some fantastic vetted organizations. I mean, you just have to this is where you need to educate yourself and go see what you think are some of the most powerful organizations. One of the ones I love in Oakland is Color of Change. And so if you're living, I don't know where you're living, but you really have to do your own research, because in every community there are different organizations. But at the very least, if you're spending money right now, spend it in organizations, businesses that are owned by Black, Brown, and women, if that, you know, depending on who you're trying to support.
Thanks, Kelly. I have a question, actually. You noted in your column this week that men are less likely to wear masks, even when those masks are legally mandated, as they are here in the area. And you wondered if the fact that men are less likely to wear masks is a signal of what Laura Cray, who's the faculty director for EGAL and a great faculty member here at Haas, is that an indication of what Laura Cray refers to as, quote unquote, precarious masculinity? Can you explain what you were referring to, please?
Yeah, Laura's research is great. This is one of my favorite bodies of work that she researches. So she looks a lot at negotiations and game playing and how there are gender differences. She finds, I'm condensing a lot of research down into one finding to get to precarious masculinity, which is a phrase she coined. She finds that in a negotiation, If a man feels that he is losing in the negotiation, he is more likely to resort to immoral or unethical behavior. And there's no evidence to show that men are more immoral or unethical. What she finds is that threat to his masculinity that losing presents, that he will shift to unethical methods to win. And so she talks a lot about how I rarely get challenged for being a woman. I don't get told to woman up, but you hear, from a young age, men are told man up, don't let her get to you, don't cry, don't show your emotions. And so that it's more precarious. Their sense of masculinity can be seen as more precarious than is my sense of femininity. So full stop on that. And I love Laura's work in this space because it's very data backed. When I was looking at the mask, so I think two things are happening are possibly at play in that mask data. One is we have no political comment here, but the leader of our country refuses to wear masks. So you're seeing behavior modeled by the top, man in the United States. That's the first thing. But I remember looking at some research when reusable bags. Remember those days? I mean, it makes me sick to my stomach that I have to get plastic bags now. But when we first started to legislate or push for reusable bags, women were carrying bags of reusable bags at a far more significantly proportion than were men. And so there was a small intervention where they made some bags that had a very masculine look to them, some reusable bags, and suddenly you saw a spike of men carrying their reusable bags into the grocery store. So I think that kind of all hints back to this sense of what's a threat to my masculinity. And I also do think from there are certain folks that are in positions of privilege that don't think the rules necessarily apply to them. So the article was just interesting to me.
Well, thank you. So we're actually, believe it or not, this has gone so quickly. We're all out of time. And so I have one last question from Javed Islam. What kinds of businesses could operate more equitably and effectively on a cooperative model?
Oof, I think we see the best cooperative models in the food industry and the restaurant industry. I guess I don't see any business that couldn't model itself in a cooperative model. It's more around the culture and the values and the leadership in those industries. So I don't think there's any one industry that is most suited for cooperative modeling. I think it's humans need to be more cooperative because we're the ones that put together the models. I think that's a human issue.
Thanks, Kelly. Thank you so much for joining us today. I really appreciate it. Maybe we have 3 minutes left. So maybe we can just stop and think about Berkeley and Berkeley Haas. Berkeley and Berkeley Haas are famous for questioning the status quo. Do you think that this period will create long-term change both at Berkeley Haas, and in the rest of the country?
Yeah, it depends on the minute of the day or the day of the week that you hit me. I've been more hopeful, in all honesty. I have definitely been through some really dark times for lots and lots of reasons, but when you're experiencing what the world's experiencing and looking at the data, I'm not even experiencing what's happening in the data, I'm just reading the data. Can't even imagine the people I'm reading about in the data. With the Supreme Court decision around protections for LGBTQ in the workplace, that made me hopeful. With what happened in the California Senate yesterday with ACA 5, just simply the fact that Prop 209 is going to get put back on the ballot for repeal, I think we are seeing some indications of systemic change. But given the level of systemic racism that has existed in this country for hundreds of years, we need to see far more change for it to stick. So I think we're seeing change? Yes. For it to stick is where I really get concerned, because I think I read some point late in April, Jeff Bezos had made more money in April of this year than he had all of last year, and that's during a global pandemic. So those statistics are the things that keep me from being super hopeful that things are going to change. But I want to consistently focus on, even our institution. I was so proud of this, getting rid of what we know have been biased standardized testing. That's a big move by Berkeley. So I do think we are seeing pockets of big moves that together will really, really shift.
Thank you, Kelly. And I do also want to end on an optimistic note. Berkeley Haas faculty, students, staff have come together and had just done a tremendous job in responding to COVID-19, which came in March so quickly. And I'm just so proud of what we're doing, what our students are doing, what our staff and what our faculty have done in pivoting to a remote world and providing the best instruction possible in these really difficult times. And we're going to get to hear from more of those faculty in this process, in this series to come. Other hosts will include both our former Dean, Laura Tyson, will be hosting some of these, and we will have some other, Don Moore, who recently wrote a book called Perfectly Confident, will also be hosting some of these talks. And so I look forward to you all joining us in this next several months to talk about what we can do in this very difficult period. Thank you so much. And thank you, Kelly, for your wonderful, sharing your wonderful center's ideas and achievements with us today.
Thanks, Anne.